coming up on today's show. It was 30 years ago that Baptist Health pioneered Arkansas's first heart transplant, and today Baptist Health is still the only hospital in the state that performs adult heart transplants. So today we are happy to have Dr. Patrick Campbell in, a heart failure specialist with Baptist Health. We're going to talk a little bit about heart failure, the Transplant Institute in the studio, and really how far it's come in those 30 years.
That is incredible. 30 years.
Yeah.
Imagine what that was like back then versus all the technology and stuff they have now. Pretty incredible.
From the station that's on your side, this is Channel 7 News Good Morning Arkansas.
Welcome back, everybody. 30 years ago, Baptist Health pioneered Arkansas's first heart transplant, and today Baptist Health is still the only hospital in the state that performs adult heart transplants. And joining us this morning is someone that knows the heart program well. It's Dr. Patrick Campbell, a heart failure specialist with Baptist Health Heart Failure and Transplant Institute. Thank you so much for being here with us this morning. Such an important topic. Let's start off talking about what the technology was like 30 years ago performing heart transplants.
Well, thank you for having me. 30 years ago was really the very beginning of heart transplants, and we were trying to figure out, I wasn't, but they were trying to figure out, really how do we keep these patients healthy and alive after their heart transplant. Immunosuppression medications have come a long way, and patients typically were on 3 or 4 medications, and we've been able to adjust that over the last 30 years.
Which makes it so much better for those patients having to go through such an intense surgery, I would imagine.
It does. It definitely helps a lot. I mean, early on they are on a lot of medications, and there's a lot of side effects to those medications, but we've been able to improve the medications that we use and other technologies to maintain and monitor their heart failure, their heart transplant afterwards, and we do provide a better quality of life than they've had for many years.
So I imagine in 30 years there's been a lot of heart transplants done with Baptist Health.
I think we've done about 289 since the first heart transplant in 1989. Dr. John Ransom and Steve Hutchins started the program, and they've really grown it into an amazing opportunity here.
That's a lot of lives saved.
It really is.
And so just a few years ago, Baptist performed the state's first total artificial heart transplant. Tell us what that means.
So for patients who are unable to get a heart transplant or we can't find a suitable donor, there is a device called a total artificial heart. And essentially it is a mechanical pump that replaces both sides of the heart, and it keeps them alive while they're waiting for a heart transplant.
So that is just a temporary fix.
It is. It's meant as a bridge to a transplant for these patients. And so they do carry around about a 15-pound backpack, but they're able to leave the hospital and go about their life and live a fairly normal life until a heart can become available for them. Comparing,
though, just carrying around a 15-pound backpack to what they would be like if they didn't have anything, I mean, that's got to be...
It's a big change. It's a big change. Patients who need a heart transplant typically are so sick that they can really do very little throughout their day. They're not able to get out of bed or shower or cook food for themselves without being short of breath and fatigued. It's a very hard and difficult way to live, and so anything that can make their quality of life better really does improve their life until transplant's available.
So you see, obviously, most of your patients are dealing with heart failure and going through that process of figuring out what their next steps are. What does it take to diagnose someone with that?
Heart failure is typically diagnosed usually when patients are feeling that they're bloated or swollen, they have swelling in their legs, they're short of breath, they're not able to do their daily activities like they were before. It may even be subtle, such as climbing a flight of stairs makes them more short of breath than they were. The diagnosis requires an echocardiogram, seeing a cardiologist, and then some blood tests as well, but it's fairly at times it can be fairly subtle and difficult to diagnose, but other times it's very obvious. And so it's really important to follow with a primary care physician, and if you do have a history of heart disease, to follow with a cardiologist.
Yeah, some of those symptoms seem like something you wouldn't necessarily associate with heart failure. You know, being out of breath, walking up the stairs isn't something you're instantly thinking, oh my gosh, I have heart failure. So sometimes do people not get diagnosed for longer than maybe they should have?
It does, especially in younger people. They're often diagnosed with pneumonia or bronchitis. Some people are diagnosed with gallbladder disease, and it's really heart failure. And so in the young, it can be very subtle, and they can be misdiagnosed because a lot of the times we don't think of heart failure in an 18, 20, 25-year-old. And so it's really important that if your symptoms aren't getting better, or that you feel something is not right, that you communicate with your physician.
And Baptist, you guys do heart transplants, obviously, but there's more to it than that. Not all people need the transplant. So talk about some of the other options.
Well, so we're the only comprehensive heart failure program in the state of Arkansas, and we offer everything from medical therapy, which is their medications and lifestyle modifications, through IV medications and inotropes. We do have temporary mechanical support, but those are typically temporary heart pumps to get people to the next step as a bridge to transplant. And we have ECMO, but typically our goal is to keep people away from surgery if necessary. If a transplant's not an option, then the best option for them would be a left ventricular assist device. We typically use the HeartMate 3, which is the newest generation pump available, and it is a pump that keeps people alive and healthy and out of the hospital. We have some people been on it for 4 years, and even the older generation have been on it for 10 or 12 years. So we really do have a lot of options for patients with heart failure before we get to a transplant if necessary.
Yeah, so how hard is it to get a viable heart? I know that sometimes people, like you said, go 4 years waiting for one. So what do you do in the meantime to try and support these people going through that?
Well, as we said, the left ventricular assist device is probably our best option. It's our best bridge to transplant. Patients with a HeartMate 3 or a HeartMate 2 are out of the hospital, they're at home, they can go back to work, they can live their life normally. They are carrying around about 8 pounds of batteries and a little bit of a controller. So there is a lot that goes into it, but they do have a normal quality of life while they wait for a heart transplant. So it is, that's the best device and technology that we have available for them.
That's incredible. And all that's changed over the last 30 years is pretty incredible. So where can people get more information about what you guys do?
Well, I recommend talking obviously with their primary care physician and their cardiologist if they're concerned their heart failure is getting worse. But if they go to the Baptist Health website, they'll be able to get a link to our program, our other physicians, my partners, and schedule an appointment if necessary.
Awesome. Such great information, Dr. Campbell. Thank you so much for being here with us today. An important topic, and congratulations to Baptist on the 30-year anniversary.
Thank you very much.